First thing I'm going to get you to do is grab a towel and fold it up so it's about the size of your fist. I just grabbed a tea towel and doubled it up and folded it. Now the reason we're doing this is because we're going to put it right between here, right on top of our hip bone and between the ribs. This is to help to stabilize the back in the side lying position. So I want you to get nice and comfortable. Hands on your hip, or you can place it in front of you for more stability. So what I'm doing here is I'm just squeezing both my glutes together, almost like I'm trying to hold a penny between the cheeks, and relaxing. And squeezing, squeeze, 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 and release. And squeeze, and release. And squeeze, squeeze, squeeze. What we're doing is we're developing blood flow to the area. So now we're going to squeeze our glutes so much that that is what's lifting our knee to the ceiling. And notice how my hips and my core is nice and tight. I also want you to think about almost holding your pee. I also want you to help support that pelvic floor because the pelvic floor also makes up our core stability. So really squeeze the glutes, hold the pee, and lift the leg towards the ceiling. Hold for 5 and control down for 5. And relax for 5 seconds. Hold the pee, squeeze, and lift up for 5. Really squeeze the glutes. Hold for 5. And lower, controlled for 5. And squeeze everything. Hold the pee, tight core, squeeze glutes, lift up the knees for 5. And slowly lower for 5. And squeeze everything, hold the pee, squeeze the glutes, lift the knee for 5. Hold for 5. And control everything down for 5. So we're going to slowly remove the towel. We're going to roll onto the other side and place in the exact position right between the hip and the ribs. So we're going to start with just squeezing our glutes here. Now I also want to make a comment. If you need to put a pillow between your knees, do so. So we're going to be squeezing here. Good. Squeeze, 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 squeeze. And relax. And squeeze, 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 squeeze. And relax. And squeeze the glutes together. Really squeeze. Really try to prepare them for the work that they're about to do. And relax. Squeeze them together, really squeeze. And release. So now you're squeezing everything as you're lifting your knee up towards the ceiling, including your pelvic floor. So almost hold your pee. Keep your core nice and tight. You can even check that like I'm doing here. And slowly lower the knee towards the floor. So everything we're doing is very controlled. Squeeze everything, squeeze the core, squeeze the pelvic floor, squeeze the glutes as you're squeezing that knee up and you're holding it for 5 seconds and controlling down for 5. So we're relaxing for 5, lifting for 5, holding for 5, lowering for 5, relaxing for 5. So squeeze everything and hold for 5. and lower. And squeeze everything up, core, pelvic floor, glutes, hold. And lower the knee, but still keep everything contract. Now you can completely relax. Squeeze everything, pelvic floor, glutes, core, knee up towards the ceiling. And slowly lower the knee towards the floor. So we'll remove again. We're going to switch to the other side to give that other side a break. So this is where I highly encourage you to put a pillow between your knees if you need it, because we're going to be working the range of motion of the hips while keeping our core nice and tight with limited movement. So you're going to bring your heels up towards the ceiling like this and gently lower. So nice, slow, controlled for 5. Hold for 5. Slowly, controlled, lower for 5. So you see how the rest of my body, my core, is not moving because I'm squeezing my pelvic floor, I'm squeezing my core as if someone's about to punch me in the stomach. And making sure my pelvis is staying stabilized. Now, if I'm lifting my legs too high for you, just only lift it 25% or 10%, or just initiate the movement without even lifting the legs off the floor. This is all about what level you're at, what you can do so that you can work towards progress. This is not about perfection. This is about progress. And this is about getting you to the level you need to be in order to improve yourself. Good. So now we're going to lift just the top leg off. So we're going to squeeze our glutes. So this is where we're working the gluteus medius muscle. This is the muscle that helps to stabilize the hip. And we're going to slowly lower down. So everything we're doing here, again, just to remind you, is all controlled, very purposeful movements. Nothing's just flipping and kicking your leg up and letting it drop down. It's all very purposeful movements. I worked with a physiotherapist when I was in Florida, and she did a study on pelvic stability. So all these exercises that we're doing are revolved around pelvic stability because they prove that when you have a strong pelvic floor and pelvic region and core, the rest of your body, no matter the element, improves in terms of musculoskeletal issues. Squeeze the core, lift everything up. So you're lifting the whole leg. Again, if this is too much of a range of motion for you, just do what you can. So you're going to prepare to roll on to the other side. So when you're turning, so you don't have to rotate to face the camera like I am. You can turn away if you need to. I want you to keep your core tight so that when you're moving, you're not shifting things out of alignment. The same thing here, nice, slow, controlled. Keeping your core tight, shifting your legs up, and controlling the movement down. Again, nice, slow, controlled movement. And controlling legs down and up. Keep everything tight, pelvic floor, core, holding, and now slowly lower towards the floor. Squeeze and lift everything up. Good, hold. And lower towards the floor. Just gonna do one more here. So squeeze everything up. Keep everything tight. It's only your legs that are moving, not the rest of your body. And now slowly begin to lower. Good. So we're going to lift the whole top of our leg here. Really working that gluteus medius. And slowly lowering it towards, so again, we're relaxing for 5, lifting for 5, holding for 5, then lowering for 5. So lift here. Really make sure, so place your fingers on the sides of your hips, and you should feel a muscle pop out into your fingers. So that's that gluteus medius we're working. Really engage that, lift the leg, hold, and slowly lower. And relax. Again, the rest of your body, your spine, your core should not be moving. You're holding everything so tight and controlled that the leg and the pelvis, the muscles in the pelvis are the only thing that's moving. You know, within reason. Obviously, there's going to be a little bit of engagement in the back, but that's how we have to think. Because, fun fact, the erector muscles in the back are also part of the overall core. So the core is like a barrel. It's not just that washboard muscle in the front that gives you the six-pack. It's everything around. So now we're going to work on the transverse abdominis muscle. So I want you to feel right on the inside of the points of the hips. And you're going to now try to get them to pop up into your hands. So you're almost going to bring your belly button towards your spine and bring it up a little bit. So this is a very, very minute movement, almost like a millimeter in and a millimeter up. And you'll feel those oblique muscles on the sides engage as well. So these muscles are also an important part of your core, which is crucial when we're trying to relearn how to stabilize our back and recover from a back injury. So now we're going to get that rolled up towel, squeeze our glutes as we lift and place it right under our back for support. But if this is too much for you and if it's painful, do without. But it's just to act for extra insurance, essentially, when we're doing these stretches. So cross one leg over top of the other and use that hand and press the knee away from yourself. And now stretch the muscles we were just working. Really inhale and exhale. With every exhale, the stretch is getting deeper. The stretch is becoming more comfortable. And we feel the pain in our back subsiding. And we're going to gently pull our knee towards ourselves this time. There should be no back pain. There should be no sharp numbness, tingling, burning, nothing like that. We should feel supported, and the stretch should feel comfortable. Keep breathing, inhale, exhale. And gently release. And you can actually hold and assist your leg down towards the floor. And assist the other leg up if needed. And adjust the towel underneath if you have to. And I'll show you how to assist it up better this time. Just kind of guide it up there. And press the knee away from you. Inhale. And exhale. And the stretch in your hip is a little bit deeper. A little bit more comfortable. And you can feel the back pain subsiding even more. Now we're going to gently, same thing as we did on the other side, bring our knee towards your chest in a very comfortable, controlled manner with no numbness, tingling, or burning felt. Just a nice, comfortable stretch in our glute area. If any of these stretches were too intense for you at all, I'll invite you just to hold that position with both of your feet on the ground. But now we're going to slowly lower. So our feet are flat on the floor. Inhale and exhale here. So we're going to now, in this position, squeeze your glutes together and release. So you can place your hands on your glutes on your side to feel them. So squeeze them and release. And I actually invite you, please place both your hands on your glutes because I want you to feel the glutes contracting. So squeeze, 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 squeeze. And release. Do they release at the same time? And do they squeeze at the same time? And I want you to squeeze again. And this time we're going to slowly release. Do you notice how maybe one isn't releasing at the same pace as the other? This is a muscle imbalance. This is a control imbalance. We want to regain that. So squeeze again. And slowly release. Squeeze again. And slowly release. And now we're going to just squeeze one at a time. So we'll start with squeezing the right side first. So really slowly squeeze it. And release. Now just slowly squeeze the left side. Squeeze, squeeze, squeeze. And release. Squeeze the right side. Slowly release. Left side. And slowly release. Right side. Control the release. Left side. Control the release. Now do both sides again. Squeeze them nice, slow, controlled. And slowly control, release. They should feel a little bit more together now. Squeeze. And release the glutes. Squeeze them again together. And release at the same time. Good. Again, squeeze together. And control the synchronized releasing of both glutes. Last time, squeeze. And slowly release. Now I'm going to get you to place your hands right on the insides of your hips again, the pointy parts of your hips. And now you're just going to try to squeeze one at a time and release. Squeeze the left side and release. So essentially here you want to make sure that your pelvis is staying nice and square and controlled, and it's not so gentle that it's shifting back and forth. So now squeeze both, squeeze and release, control the release. And squeeze both, nice and controlled. And release. And squeeze together. And slowly release. And squeeze. And release. And now we're going to remove the towel here. If it was already removed, don't worry about it. I'm going to show you how to properly get up. So squeeze your core, squeeze the pelvic floor, push with the back leg with you onto your side so that your pelvis and back stayed completely in line, and use your other arm to push you off so you're nice and straight. Now keep your back nice and straight. Squeeze the glutes to lift your body up. Do not use your back. And whatever leg you feel more comfortable stepping up with, step up on that. Use your arms to push you up, and that's how you get up. I want to thank you for taking time to do this video. And if you feel it's helped you, please share this with someone else in your life who you know would benefit. And subscribe to this video if you would like to be notified in the future of any new video releases that I release. Thanks for your support.